Hi, I'm Pernille Hansen. I'm a psychologist with experience in mental health and psychosocial responses in emergencies. I'm also a trainer in psychological first aid for the International Federation of Red Cross and Red Crescent Societies Reference Center for Psychosocial Support, also referred to as the Psychosocial or PS Center. I will lead this training today. Welcome to this training on psychological first aid in the COVID-19 outbreak response for staff and volunteers in Red Cross and Red Crescent National Societies. This video takes approximately 1 hour to watch, but the training will take you about 2 hours as you're asked to pause the video and complete some activities in the accompanying worksheet. Participating in this way will enhance your learning and understanding of the content. The training is based on the resource and training materials on psychological first aid developed by the IFRC PS Center that include a reference guidebook, a short introduction book, and 4 training modules. I will share the link to their website at the end of the training where all the materials can be downloaded. The training is also based on the most recent advice and publications to guide mental health and psychosocial support responses in the COVID-19 outbreak from leading humanitarian organizations. The aim of the training is to introduce psychological first aid and apply PFA skills to the COVID-19 outbreak response. PFA is the abbreviation for psychological first aid, and I will use that often from now on. The training starts with an introduction to PFA and then explores how the COVID-19 outbreak has affected us. We will look at what kinds of reactions one can expect people to have in this situation, exploring both common and severe reactions. Then we will look at how to help with the 3 action principles of look, listen, and link. We will end the training with focus on self-care. Let's jump straight into it. Before I tell you more about PFA, I'd like you to reflect on what you know already. In your worksheet, complete the following sentence in the simplest way you can. Psychological first aid is... Now pause the video and complete the activity in your worksheet. Then start the video again. A simple explanation of psychological first aid is that it is a set of skills and knowledge that can be used to help people who are in distress. It's also a way of helping people to feel calm and able to cope in a difficult situation. Psychological first aid rarely stands alone, and it's usually accompanied by other support. Psychological first aid skills involve knowing how to assess a situation, familiarity with common patterns of reactions to crises, how to approach someone in distress, and how to calm them if needed. It also involves knowing how to provide emotional support and practical help. Psychological first aid is psychosocial support, and it's based on the intervention principles identified by Hopfall and his colleagues for providing psychosocial support in emergencies. The first principle is about promoting a sense of safety. This can be done either on an individual, group, organization, or community level. The second principle is promoting calming. It's natural in emergency and crisis situations that people feel anxiety. In fact, some anxiety is a normal and healthy response required to make people pay attention. However, high levels of continued feelings of anxiety and difficult emotions is not good. The third principle supports the importance of having a sense of control of positive outcomes. This is promoting a sense of self and collective efficacy. When we are exposed to crises and emergencies, an immediate effect is often feeling that you've lost control. It's important to support people to regain a sense of competency and belief in themselves that they can act and handle the situation. The fourth principle is promoting connectedness. Social connectedness provides opportunities for knowledge to essential emergency response information, as well as opportunities for social support activities, including emotional support and understanding. The last principle is about promoting hope. Those who remain positive are likely to have favorable outcomes after going through tough experiences. There are sometimes misconceptions about what psychological first aid is and what it is not. So let's clarify those. Pause the video and complete activity 2 in the worksheet. There are some different statements about PFA, and you have to indicate if you think the statements are true or false. This tests what you think PFA is and what you think it is not. The answers to the true-false activity will be revealed in the next few slides that clarify what PFA is and what it is not. So, let's start looking at what PFA is. It is comforting someone in distress and helping them feel safe and calm. It's also assessing their needs and concerns, and protecting people from further harm, and providing emotional support. PFA is also helping to address immediate basic needs, such as food and water, a blanket, or a temporary place to stay. Whilst this is often surprising to people that it's part of PFA, it relates back to the psychosocial support principle of promoting calm. Addressing basic needs is often the first step in helping someone feel calm. And finally, PFA is also helping people access information, services, and social supports. There are some misunderstandings about PFA that are important to clear up. These are listed here and include attention to the fact that PFA is not something only professionals do. It is not professional counseling or therapy. It also does not involve encouraging a detailed discussion of the event that's led to distress, or asking someone to analyze what has happened to them, or pressing people for details on what has happened. It is not putting pressure on people to share their feelings or reactions to an event. So here are the correct answers to the second activity. Pause the video and have a look at your responses and see how you did. Now you might be wondering when we should provide PFA. When do you think PFA helps? A simple answer is when someone feels distress. It can be during a stressful situation, for example, while someone is going through a life-changing event, such as a divorce. It can be immediately after something has happened, for example, after someone has heard some stressful news or been in a car accident. It can be weeks after an event has taken place, or even months or years, if something reactivates feelings of distress. PFA skills can help in emergency and non-emergency situations, and in personal or public crises. The key factor to consider is whether a person is in distress and if the person needs or wants your help. Psychological first aid is a method of helping people in distress that's based on the fundamental principle of do no harm that we always follow in mental health and psychosocial support responses. To ensure that we do no harm, we pay attention to offering help that promotes safety, dignity, and is rights-based. This is of particular importance in this response, as people suspected to be infected with COVID-19 or who are ill with the virus may suffer distrust, stigma, or discrimination. This means we make efforts to avoid putting people at risk as a further result of our actions, and we do everything we can to ensure that the people we are helping are safe and protected from physical or psychological harm. Concerning dignity, it means always treating people with respect and in accordance with their cultural and social norms. Fulfilling people's rights involves making sure that people can access help fairly and without discrimination. It also means helping people to claim their rights and access available support, and we always act only in the best interest of any person we encounter. Let's talk about the COVID-19 outbreak and how it's affecting us in the world. Coronavirus disease, also known as COVID-19, is an infectious disease caused by a newly discovered coronavirus. The new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019. People can catch COVID-19 from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when a person with COVID-19 coughs or exhales. How has the COVID-19 outbreak impacted people in the country where you live and work? I'd like you to pause the video again and complete the next activity. Take a few minutes to think about all the ways the COVID-19 outbreak has impacted your country and list these. Think of impacts on the individual, community, and nation level. When your list is complete, play the video again. Here are some of the examples I came up with. You probably have other things on your list from your different countries. So here in Eswatini, we are living under partial lockdown at the moment. Everyone is practicing physical distancing, and some people are living in social isolation. It's led to a huge rise in unemployment. Many people have lost their jobs and their income. It's created a massive disturbance in education, especially as very few people here have access to internet and computers. It's reduced public transport and obviously created limited access to shops. It's also led to stigma and discrimination against recovered patients and families and against healthcare workers who are treating patients that are infected. And it's led to many healthcare workers feeling exhausted. It's important for us as helpers to have a good understanding of what challenges people are facing. This enables us to have empathy and better be able to assist them in identifying possible and practical solutions to their problems. Some groups of people are more at risk than others in this COVID-19 outbreak. In the next activity in the worksheet, I'd like you to brainstorm and list all of the key groups that you think we should pay special attention to, as they may be more vulnerable or have particular needs that we need to consider in our responses. Pause the video again and make a list of these groups of people. When you have completed it, play the video again. Here are a number of groups I thought of. Those infected with COVID-19, families and relatives to those infected, people who are in quarantine and living in physical isolation, people who have recovered from COVID-19 and may still feel weak, families and friends of people who have died, the people who have lost income and employment due to COVID-19, health workers and social welfare responders providing care and treatment to patients, people with physical and medical vulnerabilities, such as older adults, people with pre-existing health conditions, pregnant or lactating women, and lastly, people with other vulnerabilities, such as existing mental illness or living with other disabilities. It's important to be mindful of these particular groups of people who are more at risk so that we can give them the special attention that they need. The situation we are all facing is difficult, and as we have seen, impacts people in multiple challenging ways. What are some of the emotional reactions we can expect in this situation? Please pause the video again and make a list of the different kinds of emotional reactions that you expect people to have in this situation. Play the video again when you have completed your list. Here are the emotions I thought of. The first one is fear. In epidemics like this, people experience fear of being sick and the way in which one dies, or they have fear of symptoms and diseases that are easily treated. Their fear of falling ill and dying may prevent them from approaching health facilities. Some people are afraid of being isolated and separated from their families. Many people also have fear of losing their livelihood, whilst others fear the impact as they have already lost their livelihoods. Another common emotion is anxiety. Some people feel high levels of anxiety because of the uncertainty the situation causes. Others may react with anger and confusion over why this should take place and impact some of us so strongly. Others may react with sadness and loneliness, finding it hard to adjust to social isolation. And some people will be dealing with grief and loss of loved ones. It's important to understand that all of these reactions are natural reactions to an abnormal and unusual situation. However, that they are natural reactions does not mean they're necessarily minor or easy to cope with, but it does mean we can expect many people to have similar reactions. Later in the training, we'll talk more about how to help people manage some of these reactions and feelings, and how to recognize if someone's having more severe reactions that may need immediate referral for specialized help. It's important to not only consider the negative impacts and challenges people are facing, but also to focus on positive impacts of this current crisis. Remember earlier we talked about Hopfall's principles, and one of them is to help promote a sense of hope. This is best done by focusing on positive impacts. One example I've noticed is a stronger sense of empathy and solidarity amongst people in my neighborhood who are now collecting donations for people who have lost their income. What have you noticed? Pause the video again and write down some examples of positive social impacts of the COVID-19 outbreak. Examples of positive social impacts I've noticed are listed here. I've noticed an increase in empathy and a sense of solidarity amongst people in my community and even globally. Many people also display enormous courage, especially healthcare workers, who go to work to help those infected and affected and work in risky and tiring circumstances. Another positive outcome is that people are paying more attention to others and to their own behavior. It has changed the way we interact with each other as everyone is more mindful. I've also noted that many people are actually in more regular contact with loved ones, even if it's remote. So, now we're going to look at how to help people who are in distress. During this time of physical distancing, we have had to move to new ways of supporting one another and enabling social connectedness. Although there are still many helpers working face-to-face, such as healthcare workers and other responders, others can provide help and support through phone calls and video calls, or even just through short messages on the phone, through SMS or message apps, such as WhatsApp or Telegram. Despite what method you'll use to provide support, all psychological first aid is based on the 3 action principles of look, listen, and link. This model and approach to PFA was developed by the World Health Organization and is used by many humanitarian actors throughout the world. We will look at what each of these action principles involve and then specifically at how to apply them in the response to the COVID-19 outbreak. The first action principle, look, involves gathering information on what has happened and what is happening. It includes assessing the situation to find out who needs help, what the safety and security risks are, and if anyone has physical injuries. It also involves attending to any immediate basic and practical needs. Look also involves observing and identifying emotional reactions. Now we're going to think about how look actions are applied in the COVID-19 outbreak response. One example of a special consideration in this situation is thinking about safety and security precautions, specifically the infection risks, and how this leads to physical distancing and the need for personal protective equipment. What are some other examples? Pause the video again and think about how the look actions can be applied in this situation and what special considerations are needed. Complete activity 7 and then start the video again. These are the special considerations I've come up with. First, regarding safety and security. As mentioned earlier, in this particular situation, helpers have to know about and act according to infection risks by practicing physical distancing and using appropriate personal protective equipment. Another consideration is understanding expected reactions to this particular crisis. We talked about this earlier, and you are aware of and know what kinds of reactions to this crisis one might expect someone to have. Because of physical distancing and helping people remotely, it's important to know how to recognize symptoms through remote communication. Another consideration is to have updated information on the COVID-19 outbreak. It's important the helper is up to date with the correct factual information about the COVID-19 situation. A major source of stress for many people at this time is being bombarded with so much information that is sometimes contradictory. The helper needs to be able to correct someone if they believe something incorrect that could lead to a negative or harmful outcome. Another consideration is to be able to recognize signs and symptoms that someone may be infected with COVID-19. And lastly, it's important to be aware of and recognize groups that may be at particular risk, which we talked about earlier. Now I will show you a small video clip of a Zoom call between myself and a young lady, Nozipo, who called me in distress. Pay attention to how I used the look actions in the call. List these in your worksheet. Hi, my name is Pernille Hansen. I'm a psychologist. I'm volunteering here at the National Helpline. What's your name and why are you calling today?
Oh, okay, good. Yeah, my name is Nozipo. Yeah, I saw your link on a notice board at a hospital I was at recently, and I'm calling because I feel like I'm just going crazy. I'm losing my mind. There's so much going on, and I just need help on how to cope right now. And I thought maybe I could reach out to you, that maybe you could help me.
Okay, thanks. Thanks, Nozipo. Thanks for calling us today. I've got about 15 minutes that we can talk in, and in those 15 minutes, I'd like to hear more about the challenges that you're facing, and then we can try and see what ways you can possibly look at it, trying to address them. Do you want to tell me a bit more about what's going on,
Okay.
Nozipo?
Yeah, thank you. Thank you so much. Yeah, I feel like I'm going crazy right now. So much going on. Obviously, I'm sure you're aware of the coronavirus, and it's just I don't know how to live with it. It's been something that's been running, through my mind every single day, every night. I can't sleep because I'm worried about my family and how we're going to cope. I'm worried about my children getting sick or my husband getting sick and not being able to look after them, or vice versa. I'm worried about my job. I'm worried about I'll make ends meet if it comes to us losing work and not being able to have an income in the coming months. I'm just dealing with a lot right now. I'm afraid to go outside. I'm afraid to leave the house.
Nozipo, I can hear you're really going through a lot. You're facing a lot of difficult challenges at the moment.
Yeah, it's really, really difficult.
So how do you think that I applied the look actions in my initial conversation with Nozipo? After introducing myself, I tried to gather some more information about what had happened and what was happening, and what Nozipo's situation was. In that process, I was able to identify that she was exhibiting a number of different emotional reactions. She was afraid of herself or anyone else in her family becoming infected with COVID. She was afraid about whether or not she was taking the right precautions. She was also affected by how this had impacted her income and her job security. At this point, I could have focused on a number of the different things that Nozipo had brought up so far. I decided to focus on her knowledge and understanding of the COVID-19 outbreak. You mentioned quite a bit about the COVID-19 virus. Tell me a little bit more about what you know about it, just so I can make sure that you've got the updated information about the virus.
Well, I know, I've been reading a lot, and maybe that's the problem that's really messing me up, is that I've got so much information overload. Every day I'm reading something new about it, and it seems to be getting worse than it's getting better, and it's all these negative feelings of, uncertainty, and seeing how it's affecting other countries, and the death toll in other countries. And I just feel that it's so hard for me to even go outside and buy groceries, because I don't know if I touch a surface, if I'll get it. I just know that it is transferable through droplets, and anything you touch could have the virus. I've also read recently that it can survive for a week or even a month. So I feel like I need to clean everything. I'm just OCD about it right now. And at this point, it was clear to me that Nozipo was well informed about the COVID-19 disease and infection. However, she had also been given some false information. My first priority was to help clarify the information, because this was clearly leading her to feeling anxious and affecting her daily functioning with her family. There's so much information right now, and a lot of people are also spreading information that's not correct. I would really suggest that you try to minimize your use of social media at this time, and try to stick to sites and to sources of information that you can trust. So, for example, it's not true that the virus can last on a surface for a week or up to a month. A really good site to check for facts is the WHO website. They have also, they record also the false information and the myths out there. And then try otherwise to just close down, shut down, don't watch the news all the time. An important part of Look is being able to identify common and severe reactions, and to know what to do if the reactions require immediate referral for further help. Some people react more strongly than others, either due to the excessive stress that they feel, or due to other influential factors, such as earlier experiences
or how dangerous they perceive the threat or the situation, or because of their chosen coping strategies. When reactions are more severe, they interfere with daily functioning and can lead to harm. It's important to be able to identify such reactions and to know what to do and who to refer to if the person in distress needs immediate or urgent additional help. Examples of severe reactions or situations that call for immediate attention and referral include if you encounter a person who's been unable to sleep for a week or more and seems confused and disorientated, if the person is unable to function normally and care for themselves or their family, for example, they've stopped eating or cooking for their family, they're unable to keep clean, if the person has lost control over their behavior and has become unpredictable or destructive, if they threaten to harm themselves or others, if the person starts excessive or out of the ordinary use of drugs or alcohol. Some people show severe reactions in complicated situations. For example, if someone presents with chronic health conditions which need specialized support, or if there are symptoms of a mental health disorder. If a person presents with any of these signs or symptoms, the helper should assist the person in distress, access additional help as soon as possible. Watch what happened in my conversation with Nozipo, where she shares that she hasn't been able to sleep for a few weeks.
I'm also not sleeping well because I'm sitting up, thinking all the time, and I know that ultimately affects, my mental health and even just physically not being able to eat and sleep it's just taking its toll on me. I just feel so exhausted. I was even thinking it might be an idea to just even admit myself to the hospital so they can give me bed rest.
Let's talk a little bit more about the sleep. How long have you not been sleeping well for?
Gosh, I don't even know. I think the last 2-3 weeks, I would say. I haven't had a decent night's sleep, and I stay up until maybe the early hours. That's when maybe I get the energy, or rather I get the feeling of being sleepy, and by that time my kids just come and they wake me up, and and then I have to be full on mom mode, and I would love to get a good night's sleep.
Yeah.
It hasn't happened. It's been weeks.
Sleep is so important for your mental and physical health.
I really need right now is just to be able to get some rest.
Right.
Not only just on the physical, but just mentally, just to be able to shut everything out.
Applying the look actions helped me to collect information on what was going on with Nozipo and what her biggest challenges and need for help were. She mentioned a lot of different things were worrying her, but the key ones I picked up were her fear and anxiety around the COVID-19 disease and outbreak, and that she was unable to sleep, and this was affecting her physical and mental well-being. Now we move on to the action principle of listen. This action principle refers to the way the helper communicates with the person in distress from the moment they're in contact with and start interacting with them. The reason the icon for listen is an ear with a plus is because the actions of listen are more than only what we do with our ears. What we do with our ears is hearing. Listening involves a person's attitude and behavior, as well as hearing. Listen refers to how we communicate with others, and in PFA, this refers to what we call supportive communication and active listening. Listen also refers to calming a person in distress and helping them find solutions to their immediate needs and problems. Now we're going to think about how the listen actions will be applied in the COVID-19 outbreak response. One example of a special consideration I thought of was that it has led to interaction with physical distance and more remote support than before. This means we have to use our listening skills that rely more on hearing than before, as we cannot see each other and interact in the way that we used to. What are some other examples? Pause the video and list how you think the listen actions are applied in the COVID-19 response, adding to the list that I have started. The examples I came up with were that interacting with others with physical distancing has changed the way we can comfort each other. For many of us, we included physical ways of comforting one another, such as holding or hugging. Now we can't do that easily, so we have to rely on verbal communication much more, which also means we have to practice very clear verbal communication. Without physical interaction and observing one another, it's also more difficult to show someone you're actively listening. Today, many of us multitask and do other things during our remote conversations. When supporting someone through remote communication, it's good practice to stop other tasks if possible and only focus on the conversation with the person in distress. You can still show someone you're listening and care about how they're feeling. You can be calm and supportive with your tone of voice. Calming someone in distress remotely is very similar to calming someone in distress with you physically. We'll talk more about this in a little while. Have a look at the previous video clip again, and this time pay attention to how I introduce myself. Hi, my name is Pernille Hansen. I'm a psychologist. I'm volunteering here at the National Helpline. What's your name and why are you calling today?
Oh, okay, good. Yeah, my name is Nozipo. I saw your link on a notice board at a hospital I was at recently, and I'm calling because I feel like I'm just going crazy. I'm losing my mind. There's so much going on, and I just need help on how to cope right now. And I thought maybe I could reach out to you, that maybe you could help me.
Okay, thanks Nozipo. Thanks for calling us today. I've got about 15 minutes that we can talk in, and in those 15 minutes I'd like to hear more about the challenges that you're facing, and then we can try and see what ways you can possibly look at it, trying to address them. What did you notice in the video? In the call with Nozipo, I introduced myself by giving my name, information about who I was working with and what my role was. I also explained that we had 15 minutes and what I planned for us to talk about in those 15 minutes. The first step in communication can be the most important one, as it establishes the trust for the rest of the interaction. Now we will look more closely at how to calm someone remotely, as this is a PFA skill that may come in handy during this time of physical distancing. Pause the video again and list the different ways that you know one can use to calm someone in distress. Have a look at the next part of the video and see if there are any additional methods of calming you may need to add to your list that you didn't have before. I can definitely see that you're overwhelmed, and right now what you're doing right now actually is a really good strategy of every now and then stopping up and just taking a deep breath. Breathing exercises are really good, because one thing that we do when we practice slow and controlled breathing is that we take control over how we're feeling. And a lot of what you describe is connected also to the uncertainty that you're feeling at the moment. We're all in a situation that's very uncertain. We don't know what's going to be happening in the future. And I can hear also it's impacted your income and your situation, your work situation. So breathing and taking some time every day, maybe setting aside 5, 10, 15 minutes where you decide this time is just for me to sit still and to practice calm breathing is a very good practice. Another thing is also what we talked a little about earlier in terms of managing the media and the information that you get. Also, you can also manage the time that you decide to spend on worrying about things. So sometimes people feel overwhelmed because they're thinking and worrying all the time. But one strategy is to control that and say, okay, now I'm worrying again. I'm going to park that because my worry time is later this afternoon. From 3 to 4 is when I'm going to worry about everything. But try and create some time in your day that you free yourself from the mental burden of worrying about things.
That's interesting. So you say I should schedule in worrying time.
Actually, yeah.
Okay.
Again, it comes back to a feeling of gaining control over the things that are going on in your mind, because a lot of us feel like things are just spinning out of control. Here is a summary of different things you can do to help calm someone in distress, and these are all methods you can also use when supporting someone remotely. First, keep the tone of your voice calm and soft. Try to stay calm yourself. Assure the person that you're listening. Explore physical symptoms and assess if there's need for medical help. Remind the person of your intent to help and that they're safe, if it's true, of course. Encourage calm and mindful breathing. Encourage the person to connect with the ground or chair they're standing or sitting on. It's easier to guide someone on practicing calm and controlled breathing if you know yourself how to do it. Let's practice this together. Then you'll be able to repeat this activity with others who might need it. Sit or stand comfortably and take some seconds to center yourself and feel present in the moment. If you feel comfortable, close your eyes and just focus on my voice. Now put your hands on your belly and start paying attention to your breathing. Breathe in through your nose and try to bring the air all the way to the bottom of your belly. Feel your belly expanding as you breathe in. Now calmly breathe out through pursed lips, emptying your lungs completely. Let's do it again. Breathe in through your nose. Fill up your lungs, fill up your tummy, and now gently and quietly breathe out through your lips. Pay attention to keeping your shoulders relaxed and down when you do this. Repeat it a few times, breathing in, filling your belly with air, and breathing out through your pursed lips. As you breathe, you feel your body calming and everything slowing down. This helps a person in distress feel physically calmer, and it allows them to regain a sense of control of their body and thereby also their situation. Listen actions rely on the PFA skills of supportive communication and especially on active listening. Active listening is a powerful skill that can benefit in all aspects of life and not only in the context of psychological first aid. Active listening is more than just hearing what someone says. It's a communication skill that's both verbal and non-verbal. Non-verbal listening is demonstrated through body language, eye contact, the space between two people, body positioning and focusing on the other person. If it's on a video call, facing the person and showing they have your full attention. Some people show they're listening by nodding or moving their head a little. If on a phone call, active listening is having the conversation in a private and quiet setting and responding to the caller every now and then to show that you're listening. Some people make small noises like uh-huh or to show that they're listening if a person talks for a while. Verbal parts of active listening are asking questions to improve understanding of the situation, or rephrasing and summarizing what the person has said in your own words to ensure and confirm understanding, and also being encouraging and supportive. An important skill in PFA is communicating with the person in distress in a way that shows you're interested in them and that you have empathy and understanding for what they're going through. Here are some examples of ways to express interest and empathy. I'll just read a few of them. One is to say, I understand your concerns, or you have the right to be sad, or angry, or frustrated right now. Another is to say, in this situation your reaction is natural, or I'm concerned about you and would like to suggest a place where someone can help you. Now we're moving on to the last action principle, link. Remember what you learned at the beginning of the training. Psychological first aid rarely stands alone, and it's usually accompanied by other support. The actions of link usually have practical outcomes. They include giving information and helping people address immediate basic needs so they can cope better with their situation. The role of the helper is to help the person help themselves and regain control over their situation. The specific actions under the link principle are to help the person access information, connect with loved ones and support, tackle practical problems, and access services and other help. In the training video on the look action principle, we explored signs and symptoms of distress that call for immediate referral for additional help. Here's the list of more severe reactions again. In addition to this list of severe reactions, what special considerations for the actions of link do you think are needed for the COVID-19 response? I wrote one important thing so far, which is to address myths and false information. What else can you think of? pause the video and write down special considerations for the link actions, adding to the list that I've started. Here's my list of special considerations for link in the COVID-19 response. You may have some to add to this. My list includes considerations on how to address rumors and false information, how to link people to reliable information sources. Remember, rumors are common in disease outbreaks, and sharing accurate information is the best way to dispel rumors and false information. Other considerations are how to help people in isolation, knowing the national COVID-19 response protocol, linking someone who's ill to health authorities for testing and contact tracing and referral. Another consideration is to encourage people to take part in social interaction, despite not being with each other, so phone and video calls. Another is to encourage healthy living, including daily exercise, varied food, enough water and sleep, etc. And a last, very important consideration is encouraging people to ask for help from friends and family during this difficult time. Let's talk a little more about rumors and false information. It's common in epidemics like this that rumors and false information about the disease start circulating. When people receive contradictory information from different sources, it can lead to fear and mistrust of public health messages. This can cause people to not seek medical help, and some may even hide it if they feel ill. Health workers may also experience threats of acts of violence from affected people, also due to rumors or incorrect information about the disease. It's important to be aware of some of the false information that's circulating and try to help to provide factual information. In the next video clip, I want you to pay attention to how I applied some of the actions of the link action principle, where I tried to help Nosipo identify some practical solutions to one of her key problems. Sleep is so important for your mental and physical health. Just thinking about the hours leading up to sleep, is there anything that you think you could possibly change to prepare a little better for sleep?
I mean, I've read that, I need to limit screen time because I do, even when I do fall asleep, I wake up and I go straight onto, my phone and I start reading, and I think that keeps me up as well. And then, so maybe I need to try and do that. You suggest I could try and limit my screen time before bed.
Notice how Nosipo came up with a suggestion for a solution to her problem, like reducing her screen time, by herself. All I did was ask the questions needed for her to think about what a possible solution could be. In the next clip, pay attention to and write down how I apply the link actions. Despite all the challenges that you've mentioned, I can hear that you're doing so many things to cope. You're actually handling this situation really, really well, even though it feels that it's overwhelming. I was wondering, who have you got around you that can support you in this time? You mentioned that you live with your husband. Have you got some other people as well that you can talk to?
I mean, we do have family next door that are close to us. But obviously, we've been practicing the social distancing. So yeah, I do have someone. I do speak to my sister. So that helps because I feel like I can offload. I think it's just that around me, I'm just the people, that are there. They have their own problems and worries. I guess I just don't want to seem weak or something. Like I'm not.
I think this is also a very unusual situation for all of us. So everybody is going through a lot of difficulties right now. And actually, you might find that your friends and family, they really appreciate you reaching out to them, because that also gives them, in a sense, permission to reach out to you when they need help also. And in many ways, reaching out for help is actually a strength. And a lot of people feel like it is a weakness, but it is a sign of strength that you recognize, I can't manage this on my own. I need to talk to someone about it. I want to really thank you for calling in today. We've unfortunately run out of time, but I have a bit of, I have some more information regarding sleep and with some tips on how you can perhaps try to improve your sleep. So with your permission,
Okay.
if you share your email address, then I can send you some more information.
Okay, that would be great. Thank you so much. I'd appreciate that.
In this last clip of my Zoom call with Nozipo, I used a number of my different PFA skills. I praised Nozipo's current efforts at coping to give her hope and to show her that I was listening and paying attention to her. I used the link actions to explore and encourage the social support around her. I used my listen skills to normalize her feelings and make her realize that even though she was going through something difficult, many people around her were experiencing something similar. I also used my skills at psychoeducation. As I had spoken with her earlier about sleep, I asked to follow up and give her some more materials. Now we've looked at what PFA is and what it's not. We've looked at the impact of the COVID-19 outbreak, and we've explored different reactions one could expect to such a pandemic. We've also looked in detail at the 3 action principles of look, listen and link, and paid special attention to factors related to the COVID-19 outbreak, such as rumors and false information, or how to calm someone in distress. Now let's look at what you, as a helper, need to prepare to be able to provide PFA to people who are in distress. Pause the video now and complete the next activity. Take some time to think about what you need to prepare to be able to provide this kind of help. These may be personal things that you have to prepare, such as practicing your active listening skills, or they may be more practical things, such as access to updated information that you can share with other people. Here are some key things that you need to prepare to be able to provide effective and helpful psychological first aid to others. The first and most important thing is to ensure your and the other person's safety and security. So in this time of the COVID-19 outbreak, it's important that you choose a method of interaction that's safe for you and for the person in distress. You also need to prepare your equipment. That means if you're going to do face-to-face support, then you need to check your personal protective equipment. If you're planning to do remote support, make sure that you have enough airtime, internet, and a private location where you can have the conversation with the other person. It's also important to know the updated local COVID-19 response protocol before going into a situation where you're offering help to others. It's also very important to know the local referral system and be ready and able to share information about the local referral system with others that need it. Preparing to help also involves being aware of which groups may have specific needs and therefore looking out for the vulnerable groups so that you can prioritize them and protect them. We mentioned examples of these groups earlier. They include children, older adults, people living with pre-existing health conditions, and so on. And lastly, it's also very important to have psychoeducation materials that are ready to share with people. For example, on topics such as healthy coping strategies, how to sleep better, etc. Pause the video and do the next activity of completing the referral template with key numbers and information for making referrals in your country. If you don't have all the information, make it a task to find this information when you have completed the training. It's important for helpers to have referral information ready at hand. We're nearing the end of the training now, but come to one of the most important parts: self-care in times of the COVID-19 outbreak response. The COVID-19 outbreak is stressful for everyone, but particularly for healthcare workers and frontline responders. This group have got the particular stresses of caring for people who are ill, being at risk of infection, and fear of infecting loved ones, delivering difficult news of illness or even death, working long shifts, needing to follow special measures and potentially lacking safety equipment, having to work with special safety measures, and may potentially also face stigmatization. Everyone must pay attention to their own well-being in this time. Ensuring well-being in the COVID-19 response is not a luxury, it's a responsibility. This is the last activity. Pause the video again and jot down what are some of the ways that you can take care of yourself in this difficult time. Here are some examples of self-care that I noted. You may have some other examples that work better for you. Firstly, be aware that certain reactions are normal and inevitable when working under difficult circumstances. If you feel overwhelmed by the situation or by your responsibilities, focus for a moment on simple and routine tasks. Second, let your peers and supervisors know how you feel and be patient with yourself. Talk to your friends or colleagues about how you're feeling. Third, keep in touch with your loved ones and try to socialize in new ways. Also important, try to exercise a little bit every day. Get enough rest and sleep. If you have sleep problems or you feel anxious, try to avoid caffeine, especially before going to bed. Eat healthy and at regular times, and make sure you drink a lot of water. Limit your consumption or avoid completely alcohol, tobacco, or use of any substances. Remember also to do things that you enjoy and try to have some fun in your spare time. And lastly, and most importantly, ask for help when you need it. Talk about your experiences and your feelings, even those that may seem frightening or weird to you, with colleagues or with someone that you trust. Don't be ashamed or afraid to get help if you feel stressed or sad or unable to take responsibility. Many other people may be experiencing the same feelings. In this fast-changing situation, it's of utmost importance for healthcare workers and frontline responders to keep updated with all health-related development, and that includes attention to mental health and psychosocial well-being. Here are some key sites where you can find updated information. We've reached the end of the training now. Thank you for participating in this training on psychological first aid for the COVID-19 outbreak response. Thank you for the hard work you're doing and for your courage and commitment to helping people in distress. Please keep safe and wash your hands. Keep physical distance, but social closeness. Help those around you so that they can cope better. And remember to look after yourself and your well-being.